Good morning. This is Sean Spence with Let's Talk Poverty Perspectives, thoughts on solving poverty in the United States. There's a particular kind of vertigo that comes from opening a piece of mail and watching your entire future rearrange itself in an instant. You were fine. You had a plan. You had a budget, maybe even a little cushion, and then a diagnosis, a hospital stay, an ambulance ride you did not call. And suddenly, the life you were building is standing on ground that is no longer solid. This is not a story about people who were already poor. This is a story about the medical bill that made them poor. Meet Marcus. He's not a real person. He's a composite drawn from the hundreds of Americans whose stories mirror each other with painful consistency. Marcus is 47. He works in logistics. He has health insurance through his employer. He exercises, does not smoke, and has no history of serious illness. Last spring, he had a heart attack. He survived, and then 3 weeks later, he received a bill for $112,000. His insurance covered most of it. His out-of-pocket maximum, the legal ceiling on what he would owe, was $8,700. That sounds like protection. That sounds like the system working. Except Marcus does not have $8,700 in savings because 57% of Americans cannot cover an unexpected $1,000 expense. According to a survey by Bankrate, he does not have $8,700 because building savings while paying rent, car payment, and groceries on a middle income salary in 2024 is harder than it has ever been. So Marcus does what millions of Americans do. He puts it on a payment plan. He borrows from his retirement account. He stops contributing to his 401k. He calls his mom. He does the math 17 times, hoping it will come out differently. And here's where the story gets complicated, because Marcus is actually one of the lucky ones. According to the Kaiser Family Foundation, roughly 100 million Americans are carrying medical debt right now. Not from recklessness, not from laziness, from getting sick. The Consumer Financial Protection Bureau reports that medical debt is the single largest source of debt collection in this country, larger than credit cards, larger than utilities, larger than anything else. And according to research published in the American Journal of Public Health, medical debt is a contributing factor in roughly 530,000 personal bankruptcies every year, 500,000 bankruptcies every year in the wealthiest nation on earth. And the majority of those people had health insurance. Think of health insurance as an umbrella with holes in it. When the weather is mild, you barely notice. But when the real storm arrives, a cancer diagnosis, a premature birth, a serious accident, the holes are suddenly all you can see. You thought you were covered. You paid your premiums faithfully, and still the rain got through. Here's the question I want you to sit with for a moment. If a financial product in any other industry left half its customers exposed to bankruptcy level losses, we would call it a defective product. We would demand a recall. So why have we decided that this is simply the cost of being human and getting sick? The consequences of medical debt are not only financial, they are medical. Research published by the Urban Institute found that people with medical debt are significantly more likely to skip follow-up care, delay filling prescriptions, and avoid future medical appointments. Even when those appointments are critical, they get sick, they go into debt, and then, because they are in debt, they avoid the very care that might prevent them from getting sicker. The debt becomes its own disease. The people hit hardest are not who you might expect. Black Americans are disproportionately affected, with the Kaiser Family Foundation finding they are more likely to carry medical debt than white Americans at every income level. Rural Americans face the compounding burden of fewer providers and longer distances. And here's the number I find most staggering. According to the Consumer Financial Protection Bureau, more than half of all medical debt in collections belongs to people who are not actually poor, people with jobs, with insurance, with middle class incomes, who simply encountered a medical crisis their coverage was not designed to absorb. I want to be clear about something. This is not an attack on doctors or nurses or hospitals. The people delivering care are not the architects of this system. Many of them are just as frustrated as their patients. This is about a system that treats human illness as a transaction and then expresses surprise when the math destroys people. Some states are beginning to act. Colorado, New Mexico, and others have passed laws capping medical debt interest rates, expanding charity care requirements, and restricting the most aggressive collection practices. Several major hospital systems have voluntarily ended the practice of suing patients over unpaid medical bills. The Consumer Financial Protection Bureau has moved to remove medical debt from credit reports, a change that would affect an estimated 15 million Americans and could raise credit scores significantly for many of them. These are not radical ideas. They are not even particularly controversial when you strip away the political noise. They are simply decisions that a society can make when it decides that getting sick should not also mean going broke. Marcus eventually got back on his feet. It took 3 years. He is still not where he was before the heart attack, financially, but he is rebuilding, and that is the one thing about this country at its best. It has always had the capacity to extend a second chance to people who did everything right and still got knocked down. We do not have to accept that a medical bill is the thing standing between an American and poverty. Other countries have made different choices. Some of our own states are making different choices right now. The path forward is not mysterious. It requires only that we decide the people in it are worth the effort. I believe they are. I'm Sean Spence. Thanks for listening to Let's Talk Poverty Perspectives. Learn more at povertyactivist.com. Together, we can solve poverty.